Hello viewers, today we discuss about anti-inflammatory agent. So today class will discuss definition, mechanism of action, classification, structure and uses. So coming to the definition part, anti-inflammatory drugs is a property of substance or treatment that reduce inflammation or swelling. Anti-inflammatory agents make up about half of analgesic as well as reducing pain by reducing inflammation as opposed to opioids, which affect the central nervous system to block the pain signaling to the brain. Coming to the mode of action or classification, so here we divide into main two part. One is non-selective COX inhibitors, that means traditional NSAID, that means non-steroidal anti-inflammatory drugs. These are drugs such as salicylate, for example aspirin, propanoic acid derivatives, ibuprofen, naproxen, ketoprofen, flurbiprofen, andronic acid derivatives such as mefenamic acid, aryl acetic acid derivatives, diclofenac sodium as well as aceclofenac. Next one is oxychem derivatives, paroxychem, tenoxychem. Next one is pyrosol derivatives, ketorolac, indole derivatives such as indomethacin, pyrazole derivatives known as phenylbutazone and other next oxyphenylbutazone. Next one is prefrontal COX-2 inhibitors, such as some example for nimesulide, meloxicam, nabubetamin. Next one is selective COX-2 inhibitors, that means celecoxib, etrocoxib, paroxycoxib. Next one is analgesic antipyretics with a poor anti-inflammatory action. For example, here para-aminophenol derivatives, the drug is paracetamol. Pyrosol derivatives, drug is metamizole, propionate. Next one is benzoxacin derivatives, nipofen. Come to the mechanism part. So here two type of drugs is very important here. Glucocorticosteroids and known as NSAID. So here the group of anti-inflammatory agents and mechanism actions, we have two types already discussed here. So non-steroidal anti-inflammatory agent, another one is glucocorticosteroids. Generally, the phospholipids converted into arachidonic acid. The arachidonic acid again converted into cyclic endoperoxidase. The cyclic endoperoxidase converted into two divisions. One is prostaglandin, another one is thromboxane. The prostaglandin drugs mainly used for inflammation, pain and fever. The thromboxane is mainly used for vasoconstriction. In this vasoconstriction part, it is increase of platelet aggregation. The glucocorticosteroids is depressing the phospholipase A2 and following the same procedure. At the same time, NSAID drugs bind with the COX-1 and COX-2 receptors and also depressing the cyclooxygenase enzyme and also involving the process as mentioned here. Come to the structure and the uses. First one is sodium salicylate. This comes under salicylate derivatives. It's mainly used in medicine as analgesic as well as antipyretic. Generally, we can act as non-steroidal and inflammatory drugs. Next drug is aspirin. This also comes under salicylate. It's mainly used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches, and also mainly used to reduce pain as well as swelling in conditions such as arthritis. The aspirin is known as a salicylate and non-steroidal anti-inflammatory drug. Next one is meclofenamate. This drug comes under anthracic acid derivatives. It's mainly used for the treatment of mild to moderate pain from various conditions. For example, dental pain, osteoarthritis, and to reduce pain and blood loss from menstrual periods. Next is mefenamic acid. This mefenamic acid comes under anthracic acid derivatives. Is mainly used for the short-term treatment of mild to moderate pain from various conditions and also used to decrease pain and blood loss from menstrual periods. Next one is Sulindac. This comes under aryl acetic acid derivatives. So drug is a non-steroidal anti-inflammatory drug. It mainly works by reducing hormones that cause inflammation and pains in the body. It is mainly used to reduce pain or inflammation caused by arthritis and other disease. Next one is tolmetin. This comes under heteroaryl acetic acid derivatives. This is mainly used to reduce pain or inflammation caused by osteoarthritis or rheumatoid arthritis. Next drug is indomethacin. This drug comes under heteroaryl acetic acid derivatives. This drug is mainly used to relieve pain from various conditions. This medication is known as non-steroidal anti-inflammatory drugs. Next one is diclofenac. So this type of drugs comes under aryl acetic acid derivatives. They mainly used to relieve pain, that means swelling, and joint stiffness caused by arthritis. This also comes under NSAID. Next one is Zombriac. This drug comes under heteroaryl acetic acid derivatives. It's mainly used to mild to moderate severe pain and also used as pain relief from during surgery. Next one is ketorolac. This drug comes under pyrosol derivatives. It's mainly used for the short-term treatment of moderate to severe pain. It is generally usually used for the before or after medical procedure after the surgery. Mainly used for pain. Next one is naproxen. This drug comes under propionic acid derivatives. This is mainly used for reduce the pain, swelling, joint stiffness caused by arthritis, bursitis, and gout attacks. Next one is pyroxicam. This is comes under oxycam derivative. This is mainly used to reduce pain, swelling, and joint stiffness from arthritis, and also used as NSAID. Next is phenacetin. This comes under anilide derivatives. This is mainly used as analgesic as well and fever reducing drugs in both human as well as veterinary medicine for many years. This drug is introduced in the year of 1887 and is mainly used for extensively used in analgesic mixture until it was implicated in kidney disease due to abuse of analgesics. Next one is acetaminophen. This also comes under anilide derivatives. This acetaminophen is analgesic used to temporarily relieve minor aches and pain due to headaches, muscular aches, backache, minor pain of arthritis, the common cold, toothache, and premenstrual and menstrual cramps. This is also mainly used for temporarily reduce fever. Next one is antipyrin. This type of drugs comes under phenylpyrazole derivatives. This is mainly used to relieve ear pain and swelling caused by middle ear infections, and also used to help remove a buildup of ear wax in the ear. Next one is phenylbutazone. This drug comes under phenylpyrazole derivatives. Phenylpyrazole derivatives this drug agent comes under non-steroidal and inflammatory drugs and also effective in treating fever, pain, and inflammation in the body. Next one is ibuprofen. This drug comes under propionic acid derivatives. This ibuprofen is used to relieve pain from various conditions such as headaches, dental pain, menstrual cramps, muscle aches, or arthritis, and also used to reduce fever and reduce minor aches and pain due to the common cold or flu. Ibuprofen is a non-anti-inflammatory agent. Thank you all.